Alright, we'll be doing a barium enema with some overhead projections. So what I got here, I got my IV pole, some lubricating jelly, some tape, we got our barium sulfate, and then our tube and enema bag, and then gown, 45-degree sponge, and a little sheet, and chucks. And then, otherwise, I'll get my patient, Ashton. Hello there.
Hello.
I'm Mikhail. I'll be your X-ray tech helping out. Could you give me your full name and date of birth?
Ashton Mills, June 27, 2005.
Alright. And so we'll be doing a barium enema. And is there a reason why that you know what we're doing this?
I had a colonoscopy a few days ago and I wanted to go through things, so.
Okay. Alright. Have you had anything to eat in the past 24 hours? Okay. So, basically, I'll have you put on this gown, but I want you to go to the bathroom first, okay? And for this exam, we'll have to put this tube in your rectum. You might be a little uncomfortable, and then we'll do some like fluoro images, and then depending on what the radiologist says, we might do some more overhead images on that table over there. All right. So I'll give you this and the open part in the back. Yeah, it's in the back, and yeah, you can go to the bathroom and put that on.
Thank you.
I can help.
Alright.
Okay, so I'll have you for this first image, just lay down on your back. Okay, so I'm gonna bring this down. Now I'm just gonna feel for his crest, the neck crest. And then I'll move him up a little bit. Alright, this is just a scout image I'll be doing, so I'll give you some breathing instructions. Okay, so take a deep breath in, blow it all out, exposure. Alright, you can breathe. So for this scout image, we just want to see everything. We want to see the whole large intestine. And I used a technique of 32 at 80. Alright, so take this. Alright, Ashton, so now I'll have you lay on your left side.
Left side.
Yep. Left side, and then have you kind of bend both your knees, and then kind of bend this one a little bit. Your right one a little. Okay. So I would get the enema bag moving, and then I make sure it's no more than 24 inches above the rectum. And then I have Ashton take a deep breath in and then blow it all out, and then I would insert the tip about an inch anteriorly and then superiorly. And then we would get the radiologist and we do the fluoro images. Okay, so then we got done with the fluoro images, so then the radiologist said he wants some overhead projections. So, for my first projection, I'll have you, Ashton, lay on your stomach. Okay. And then, so we'll do a PA first, and we want to center at the iliac crest again. So I'll move them down a little bit. sure we're down the middle. Okay. Alright, I'll give you some more breathing instructions then. Alright. Take a deep breath in, blow it all out, exposure. Alright, you can breathe. So for the PA, we just want to see the whole large intestine, and then we also want to see the barium in the transverse colon. And I use the technique of 32 at 80 again. Alright, so now I'll do the PA axial. So, put this down. Okay. And then I'll do about 30 degrees caught head. And then, let's see. And then this one we want to kind of exit through the as is, so I'm going to try to feel for his as is. So about there, I think. And make sure we're down the middle. Okay. If you want to, you can put this arm down, or if that's more comfortable. Okay. Otherwise, I'll give you some more breathing instructions. Okay. Take a deep breath in, blow it all out, exposure. Alright, you can breathe. So for the PA axial, I use a technique of 50 at 100, and for the PA axial, you get a better visualization, kind of the sigmoid colon and the rectal sigmoid colon. Alright, so put this back. Okay. And then so now I'll put this sponge under this side so you can kind of lift it up a little bit. Alright. Alright, I'll be doing the REO now. So, what we want to do is center. We'll go to the crest again, but also try to center about an inch or two to the vertebrae on the elevated side. So, go back there. I'll mark it. Okay. Should be good. Alright. And then I'll go back there and give you some more breathing instructions. Okay, take a deep breath in, blow it out, exposure. Alright, you can breathe. So for the REO, I use the technique of around 50 at 100. And for the REO, you just want to see the right colic flexure. And so now, I'll take this out, Ashton, and let's see, we'll do, I think, we'll go have you lay on your back and trim that. Okay, and then I'm just going to put this on this side. Okay, and you can go back down. Alright. So, I'll do the RPO now. So, on this one, we also want to be kind of at the level of the crest. So, we'll go a little lower. Alright, also want to be 1 to 2 inches to the vertebrae on the elevated side. So, okay, now I'll mark it. And then I'll give you some breathing instructions again. Alright, take a deep breath in, blow it all out, exposure, you can breathe. Okay, so on the RPO, I use the technique of 50 at 100 again, and on this one, we want to see the left colic flexure. Okay, so I'll take that sponge out over there. Okay. And now, what I think I'll have you do is lay on your right side. Okay, so go to the crest again, and then also make sure I'm kind of in the mid-coronal plane. So go this way, I guess. Good, I think there. Okay. And go over here. Okay. Alright, Ashton. So I'll go back there again and give you some breathing instructions. Okay. Take a deep breath in. Blow it all out. Exposure. Alright, you can breathe. Okay. So, usually we do a right lateral with the cube, and I think this one would usually be around 50 at 100 probably, and for right lateral decube, we want to see the lateral side of the descending colon and the medial side of the ascending colon. Okay, so now for this next one, I'll have you lay on your left side. Okay. So this next one we'll be doing the left lateral rectum. So I'll try to find this as is, and then I'll center there. Oops. Out there. Yep. Okay, and then we'll also want to be in the mid-coronal plane. So okay, I'll go back there, Ashton, and give you some breathing instructions again.
Alright.
Okay. Take a deep breath in, blow it all out, exposure. Alright, you can breathe. So for the left lateral rectum, I use the technique around 110 at 140. And for this one, you just want to see kind of the rectosigmoid area, and also kind of the mucosal lining. Alright, so I'll take that. Okay. Where's this stuff? Alright, Ashton. So I'll have you. Oh, sorry. So I'll take out the tube, basically, and then we just drain the barium in the bag, and then I'd have Ashton get up, and then I'd have Ashton go to the bathroom to drain all the barium out. So I'll go to the bathroom. Alrighty. Alright, so I'll have you lay on this table again on your stomach. Alright. So now we're doing the last projection, the post-evac image. Okay. So for this one, we also want to center at the iliac crest. So look down. Okay. Okay. So down there. Okay. So mark it now. Alrighty. I'll give you some breathing instructions again. Alright, take a deep breath in. Blow it all out. Exposure. Alright, you can breathe. Alright, so on here, I use the technique of 32 at 80, and on this one we just want to make sure that the colon is drained of the barium. Alright, okay, move this up, and then you can get up, Ashton. Alright, so we're all done with those. So what I want you to do kind of the next following days is just drink lots of water to get all that barium flushed out. And if you take laxatives, take those, keep taking those. And also your stool might be white, and that's just from the barium. So just to let you know about that. And then otherwise, I think I'll have you get changed. And do you have any other questions?
I don't think so.
Okay. Alright. Well, we're all done, so thank you.
Yeah, thank you.